watching Hindustan Times and I'm Aditi Prasad. I'm joined today by a special guest, Dr. Harman Boparai, an anesthesiology specialist and critical care doctor based in New York. Dr. Boparai traveled to his hometown Amritsar in India to help during the second surge of the COVID-19 pandemic. Interestingly, he was at the front lines of the fight against COVID in New York last year. Remember, New York was an early epicenter of the COVID-19 pandemic in the United States and saw some similar images of patients gasping for breath amid scramble to find enough breathing machines to treat its surging list of positive patients. But now here in India, he's anguished by the surge in India and the virtual breakdown of the healthcare system here. Welcome to the show, Dr. Boparai. I'm going to ask you a very simple question, first of all. You came to India about 2 weeks ago, but I understand that you were scheduled to go somewhere in Africa. But instead, you requested that you come to India to help during the second surge. Why did you specifically decide to come to India during this time?
Thank you for having me, Aditi. You're right. I was scheduled to be in South Sudan currently with an international humanitarian aid organization called Doctors Without Borders. Now, given the situation here, it was decided that my efforts are better utilized here. I care for India. It is my home. It is where I've grown up. And to see these scenes that are really unprecedented in the history of this country is heartbreaking. So this is where help is needed, all the help that we can get, and this is where I am.
So when you came first, you went to Amritsar, your hometown. What have you been able to accomplish over the last several weeks in Amritsar?
One of the first things that I wanted to do, even before I knew of this wave or any of us did, was to be able to see how we can build capacity. India was in a better off state than many other countries had been over the last few months, which is one of the reasons we let our guard down. But that is the time that is most appropriate to build capacity, to plan, to have policy in place. There's a hospital that I work with in Amritsar called Dukh Nivaran Hospital. So I got to training the staff at that hospital on COVID protocols, on what we had learned in New York, while talking to the district administration that was already, by the third week of last month, struggling with oxygen supplies to the hospitals that had been designated as COVID facilities. Now, over the last 2 weeks, that has been our major role in Amritsar, or mine, is to get the staff ready in basic precautions in taking care of COVID patients and taking care of themselves, which we often ignore. At the moment, I'm in Mumbai with the same organization, Doctors Without Borders, to help with a 1,000 bed COVID facility here and advise and do whatever we can in order to assist the efforts going on in Mumbai.
What is it that you feel, I mean, you've been here for a couple of weeks now. What is it that you feel that the healthcare system here is not doing, or it should have done, or it should have prepared for? And if you can, I mean, not just the larger healthcare system, but even the doctors that you're training. What are those little things that you feel that should have already been there and is not there? That training should have been imparted already.
Whenever we think of an emergency or a pandemic, which is something like none of us in living history have seen, we have to look both from top down and bottom up. Now, from the bottom up, it is our role, the ones who have experience and the ones who are in the public health sphere or have had the trainings themselves, to train the doctors, nurses, ancillary staff in how they can best protect themselves, how they are to handle a surge in cases that overwhelms the capacity of that particular center, both in terms of logistics, supplies, in terms of how they handle the patients themselves, in terms of the protocols of care that need to be instituted. Whenever there's a time of crises, it is very hard for people to go back to the book and figure out what it is that needs to be done. Now, one of the trainings that I have is in trauma. And what you learn when you're in a trauma hospital is that you have to think in fractions of seconds. You almost have to have those trainings ingrained in you from the top down times like these, like we had over the last few months, which was tolerable in India, are times to institute policy or to look at our supply chains, our logistics infrastructure on what our preparedness is. This requires regular meetings of central as well as state bodies on COVID preparedness. And unfortunately, I think a lot of that has been lacking in India over the last few months, which is one of the reasons why our country is seeing such a difficult time.
All right. So, what more could have been done by the, as you pointed out, have more meetings, get COVID prepared, but in terms of building capacity in our healthcare system, what more could have been done?
The very first step is data, the gathering of projections of what we expect in the coming weeks and months in terms of a surge in infections. Now, the vaccinations had been doled out on a stepwise basis, which in hindsight should have been a much wider vaccination campaign. We shouldn't have been dependent only on India-made vaccines. We should have made people eligible early on and made sure that we have orders placed and the capacity to vaccinate people when we have the time. Now, in addition to that, the projections that are made, the ICMR and institutes like that do predict the virulence, the transmissibility of the genomes that are coming in because the virus mutates. The natural course of a pandemic is that a virus usually goes from more virulent strains that harm patients more to more transmissible but less virulent strains, because that's how the virus reaches the widest population.
Mm-hmm.
We are not there yet. We are at a high transmissibility, but also at a high virulence, which is something that, given the time we had, I think that even now we can design policy in terms of how we can get the hospitals the oxygen they need, get the personnel trained and get them enough personnel, because that is another shortage we're facing. And, in emergency times, it needs to be all hands on deck.
Right, and already our principal scientific advisor to the government is already predicting. He said that a third wave is inevitable, and so I don't know. We've not even finished grappling with the second wave, and now we're talking about a third wave. I want to talk to you about New York City. You were also at the front lines of the COVID fight in New York City last year. What sort of a comparison do you draw between what New York saw last year and what India is seeing now?
One of the major differences in what we had to deal with in New York and what we're dealing with now here in India is that when the first wave came to New York, we barely knew about what COVID entails. We did not know the longer term effects of the virus. We did not know what medications work and how they work in terms of even the steroids that we use so openly and somewhat reliably now. And we did not have vaccines. So these are major advantages that we've gained over the course of the last year of this pandemic. And New York also, as a lot of the world saw, was in a helpless stage in the first few days when we were overwhelmed with the number of patients. Our staff was getting sick. We lost some great people. I lost physicians that I worked with and looked up to who delayed their retirement to continue to help out. Now, India is seeing a devastating surge, which has overwhelmed not only medical practitioners, but even the ancillary people that are trying to help out. But the difference is that we do have the vaccines. We have the knowledge from the rest of the world. We know how simple measures like distancing, like hand hygiene, like even lockdowns if necessary, which I know aren't exactly a simple affair in India, are required to stem the spread, which is so rampant right now. And we have those lessons from all the knowledge we've gained.
When you were speaking earlier, I remembered the Lancet editorial, which says that India has squandered away its early successes in controlling COVID-19, and Prime Minister Modi's government presides over a self-inflicted national catastrophe. Do you believe that editorial? I mean, I'm sure you read the editorial. Does that resonate with how you feel?
I have read what the Lancet said. Now, it is the job of public health officials as well as government officials to be accountable to the people that they serve. This is universal in democracies. That is the foundation of a democracy. Now, in India, what I've learned also that I knew growing up is that our country, somehow accountability is not at the forefront of policy. If you try to hold some people accountable, it is considered a political statement. It absolutely is not. These are people who are public servants. They've been elected by the government. Now, whether it is the central government right now or some state governments, so much could have been done across the board. There has been a failure in so many ways that I think that the public health infrastructure in India needs to look into. The Lancet definitely put a square blame at some of the policy gaps that were there. I agree, there are policy gaps. This is not a political statement. It's a statement based on facts. Any kind of nationalism, which I think to believe national pride, should be based on humanism. If you cannot take care of the people in your country, if the humanity is suffering, what kind of pride can we take as a nation? The healthcare need is a basic human right for the people, and the people of India deserve that right to be met.
What more can the central and state governments do right now, given the situation that we are in? Blame games obviously will come later. Lancet has obviously made an opinion, has put out an opinion on where it thinks we went wrong. A lot of experts in India have their own opinions. There are people who might differ, and there is this whole thing about center taking responsibility versus health being a state subject. So therefore, the state governments drop the ball and so on and so forth. But without getting into the politics of it, how do you see, and the blame game right now, how do you see what more can the governments do? And I mean both central and state governments, to tide over the present crisis. Now, from here on, what are the steps we need to take urgently?
Let me start with the most acute phase of the crisis where we are right now. I believe in what Dr. Fauci, when he was talking about the Indian situation, has suggested in a capacity of just an American citizen. India is a sovereign nation. It needs to take its own decisions, but we need to consider a lockdown. We need to make sure that the people who are the most harmed by such a step are taken care of and the basic necessities are supplied. Now, that is a big ask. And if we cannot do that, then the state and central governments need a seamless coordination. We need central commands or at both the federal as well as the state level that are constantly in touch, that are on an hourly or 2-hourly update to each other regarding the availability of oxygen, regarding the bed capacity, regarding what is happening in their particular state in terms of logistics and supply chains. Now, these are not attractive, sensational subjects that you can go to the masses and say that, look at that supply chain data. But this is what is necessary. We need to build a skeleton in this country, and very quickly, that can deliver the things where they are needed. We have most of the oxygen that we need. The supply is one of the biggest issues. Similarly with vaccines, even the ones we have, our vaccination rates have dropped substantially. This requires coordination across party lines, across state and federal bureaucracies. And we can achieve a lot if we get down to it and have a coherent command system that at the central and state levels coordinates this care on a regular basis, just like the Supreme Court started a central task force for oxygen that I was reading about.
Right. Your doctoral advice to people battling the virus at home and their caregivers right now, and there are too many of them in India. So I'm just putting it out there. What, as a doctor, as a critical care doctor, what would be your advice to them, right?
The biggest thing that I'd like to put across is that the simplest interventions matter the most. Hand washing, wearing a mask when you're in close proximity of people, but absolutely wearing it when you're outside of your house. Social distancing, staying at home if you can, are some of the most reliably efficient interventions that every one of us can do. That is both a sense of responsibility towards our own health, but also the health of others. We need to support each other in this time. The ones who have symptoms, there are resources that I think are now becoming more available in terms of assessing how bad your symptoms are. If you're short of breath, if you have a pulse oximeter, if you can measure that and get that information to a healthcare professional who can then give you advice on whether you need to seek help at a hospital or not. And then, of course, there are bigger interventions that we need to look at in terms of the society as a whole. How we look at this virus, how we look at our responsibility to each other, and the pandemic of fear that is generated and panic. There has been news of hoarding of oxygen cylinders, of oxygen concentrators. We are better than that. India is full of people with biggest hearts, and it's one of the most resilient people in the world. Now, what we can prevent in this atmosphere is the pandemic of fear, as we can reassure people that if they take these basic precautions, they will be safe. In all likelihood, whenever vaccines become available, people should be able to get vaccinated as soon as possible. If you're eligible, if they're available, get vaccinated. And with these simple interventions, we can save many more lives than very specialized equipment like ventilators can. This is a time of public health as well as social interventions as well as introspection.
I mean, thanks to doctors like you who are actually coming back here, giving back to the country at a time when the country really needs it the most. Before I let you go, I just have one more question to ask you. What more do you hope to achieve out of your stay here in India?
I've extended my stay in India for at least the summer, if not for longer. Now, I am working with organizations, both this humanitarian organization that is international, but also local organizations, in order to see what the shortcomings were in how we can support our existing infrastructure while at the same time building capacity. I must say that I salute all the physicians, doctors, nurses, and staff that have been showing up at the risk of their own health. They're the real heroes. They're the ones who are risking their own lives. This is not what we are trained in medical school to do. This is really above and beyond the call of duty, but also the NGOs and civilians that are helping each other out, that have started these campaigns to help people out. All of this is very encouraging, and whatever little part that I can play, I'll continue to play. Currently in Mumbai, we'll see what we can do in our advice for this hospital in streamlining care, but also starting campaigns of vaccination for rural areas where now the virus is spreading more rapidly than it has before. And while all of this needs comprehensive planning, at whatever stage, India is a big country, we have a big population. In whatever stage we can help, we will. And I'm here for that.
Thank you so much, Dr. Boparai, for your time. And I hope that we are able to speak to you again and take more insights from what your experience here in the COVID fight and during the second surge in India has been. Thank you for joining in the Hindustan Times. Thank you, viewers, for watching this podcast.